Welcome to today's episode for all humans. While our world may be deeply divided on many issues, one thing we can all agree on is that we generally want what's best for our children. This makes the ever-increasing cases of depression, self-harming and suicide amongst teenagers that much more alarming. Despite our best collective efforts as parents, guardians, teachers and role models, our kids are hurting to the point where they turn against themselves and their own bodies. According to the Centre for Discovery, a teenager commits suicide every 100 minutes. And while over 20% of all teenagers experience depression before they become adults, only 30% of those who are suffering are getting help. In 2018, the New York Times reported that nearly 1 in every 4 teenage girls would self-harm, which is twice the rate of teenage boys. What's more, according to a paper by Drs. Sim, Rowan and Datches, instances of depression and self-harm are beginning even earlier in childhood and adolescence, and they say that very limited information is actually available about self-harm in younger children, aged 11 years and under. I'm not sure what's more alarming, that such a gap in information exists or that we actually need information like that. Clearly something has to be done. As always, it's impossible to fight an enemy that we don't understand. So we need to look at the problem right in its ugly face if we want to make any headway. According to the article Emergency Department Presentations for Self-Harm Among Ontario Youth, published by the Canadian Journal of Health, self-harm refers to non-fatal self-poisoning or self-injury, irrespective of the apparent purpose. Similar to non-fatal suicide-related behaviours, self-harm encompasses suicide attempts as well as non-suicidal self-injury. Self-harm is a major risk factor for suicide, the second leading cause of death in 15 to 24-year-olds worldwide. Self-harm among the youth is also a public health issue in its own right. Yes, you heard that right. According to the World Health Organization, suicide is the second highest cause of death in teenagers and young adults worldwide. It's interesting, or perhaps horrifying, to note that while the term self-harm frequently calls up images of cutting, the aforementioned Canadian article reports that in both Canada and England, the most common method of self-harm was self-poisoning only, then self-cutting only, other injuries only, or multiple methods. So why do so many teenagers self-harm or attempt suicide? Simital's report on Spandler's 1996 study, in which young people who self-harmed described it as a multi-purpose coping mechanism, Spandler found that the purpose of self-harming included a number of things: getting rid of distressing feelings, not having to think about painful memories or thoughts, getting out of a difficult situation, creating a situation of comfort and security, transferring emotional pain onto a physical thing, controlling something in their lives, or self-punishment. Many participants experience themselves as not being valued or worthwhile. This brings us to a very important point. We need to be very careful with our vocabulary when we try to nail down just why it is that teenagers engage in these behaviours. There have been a number of myths perpetuated about self-harm and suicide attempts, one of the most pervasive being that they're just trying to get attention rhetoric. Simital, like many other specialists, have found that the reasons young people want to hurt themselves frequently include self-hatred and the desire for self-punishment. The closest these experts get to "they're looking for attention" is to say that they had wanted to die and they had wanted to find out if someone loved them. Isn't that just a terrifying statement to hear from a child? I wanted to know if anyone loved me. That's not a cry for attention, that's the drive to fulfill a basic human need of existence. Mother Teresa, the Roman Catholic nun and missionary, once said that the greatest disease in the West today is not TB or leprosy, it is being unwanted, unloved and uncared for. We can cure physical diseases with medicine, but the only cure for loneliness, despair and hopelessness is love. There are many in the world who are dying for a piece of bread, but there are many more dying for a little love. Our teenagers are showing us exactly what it looks like to die for a little love. But are we paying attention? And if this is the case, then the first and greatest thing that we can do for our children is to love them and let them know that often and emphatically how loved they are. And we must strive to understand what has led them to a place where they feel so unloved that they hate and want to punish themselves. As the mother of teenagers, I, like other parents, often make jokes about the inner workings of the teenage mind. But the fact is, there's nothing funny about it. It's frequently a dark and hostile place that, even though we were all teenagers once, adults are just not prepared to deal with. The problem has reached an all-time high, and the numbers are still rising. In fact, when asked about training, most school staff interviewees, excluding the school nurses, reported that no explicit training about self-harm had been given to them and described feeling unsupported for this aspect of their work. And if teachers are feeling unprepared, how much more so are parents? The same survey of teachers finds that there seems to be a sense that the whole subject is taboo and belongs over there, and a feeling that we can't deal with this. Sim et al. Tells us that in Spandler's qualitative study concerning self-harm among adolescents and young adults, participants talk about how, after having sought help, they would predominantly encounter unhelpful beliefs, attitudes and responses. For example, telling them off, being patronising, being threatened and not being given time and space to talk, which would often trigger further self-harm. Research with adults and adolescents who have self-harmed has shown that establishing effective communication is recognised as an essential part of preventing further self-harm, and that the opportunity to talk can be a relief for the person who is self-harming. But these kinds of conversations require us to be every bit as open and vulnerable as our kids need to be, and that kind of courage can be hard to conjure up. This courage is in short supply within all communities, including in many religious communities, where talking of self-harm and suicide, depression and anything associated to mental health can often be taboo and strictly off limits. And if these topics are ever discussed, it's usually done so with negative tones and dark warnings of how wrong it is to harm yourself and how totally against the religion it is, but rarely offering solutions to those that are suffering. Yes, it is true that all major religions and belief systems discourage self-harm or suicide. In fact, anything that can harm a person is forbidden because it usually causes more suffering to the individuals practicing it and to the people around them. And For All Humans is not here to lecture you about how religions outlawed self-harm and suicide. It's clear they do, including Islam. We're here instead to ask and to answer the loaded question, does religion help in protecting our youth from depression, suicide and self-harm? With several studies as evidence, the answer seems to be a confident yes. For a Harvard study published in 2018 in the American Journal of Epidemiology, Chen et al. Discovered that those who attended weekly religious services or prayed or meditated daily in their youth described a greater satisfaction in their life and had an 18% more positive outlook in their 20s than their non-religious counterparts. 16% more reported higher happiness as young adults when they prayed or meditated at least once a day. Furthermore, 33% were less likely to use illicit drugs. The John L. Loeb and Frances Lehman Loeb Professor of Epidemiology at the Harvard T.H. Chan School of Public Health, Tyler Vanderveel, concluded that for adolescents who already hold religious beliefs, encouraging service attendance and private practices may be meaningful avenues to protect against some of the dangers of adolescence, including depression, substance abuse and risk-taking. In addition, these practices may positively contribute to happiness, volunteering, a greater sense of mission and purpose, and to forgiveness. This goes a long way to protect our children and youth from depression, suicide and self-harm. And that's great for Muslims, as one of the fundamentals of the religion is its 5 daily prayers. And one of those prayers is the Friday prayer, a weekly congregational service that allows the community to come together and to pray in unison, which also helps with warding off depression and loneliness. A review article called Religious and Spiritual Factors in Depression, Review and Integration of the Research states that religious service attendance is known to lower rates in the incidences of depression by 20 to 30%, and with 3 to 6-fold lower rates of suicide. The same review says that religious service attendance is also associated with less alcohol abuse, less illegal drug use, and better mental health, among other benefits. The review also found that 61% of the analysed studies report less depression, less anger, and less hostility or faster recovery from depressive states for those with more religious or spiritual involvement compared to other treatments or controls. 3/4 of studies found an inverse relationship between religious or spiritual involvement and suicide attempts, as the individuals were better equipped to cope with stresses in life. A study of 330 consecutively hospitalised patients at Duke Hospital in North Carolina showed that 42% of the patients reported religious faith or activity as a means to cope with their illness. Religion and spirituality also impacts daily decisions that can reduce the likelihood of stresses happening and therefore reducing depressive thoughts, suicidal inclination, and self-harming practices as coping mechanisms. This is because religion is associated with altruism, gratefulness, forgiveness, less delinquency and crime, less substance abuse, better school performance, and more disease prevention activities. Not yet convinced? Let's take a look at another study. The authors of Religion Replenishes Self-Control say they have found that religion and religious concepts allow individuals to exercise and refuel when in limited supply their self-control. This self-control allows people to endure negative experiences for a longer period of time, providing psychological nutrients that are necessary for adaptive behaviours, as well as a variety of socially beneficial behaviours to flourish. Let's look at one last study to drive this point home. A study of around 1,800 teenage students from Trinidad and Tobago investigated the link between religiousness and suicide, and they discovered that religiousness was a protection against suicidal thoughts for those who looked to God for strength, comfort, and guidance. Those students who attended a religious service more than 7 times in the last 6 months showed reduced suicidal ideation, but not suicidal attempts, as compared to those who had not attended a religious service in that same time period. Secondly, those who prayed with their families more than 7 times in the last 6 months showed reduced suicidal ideation and attempts, as compared to those who had not prayed with their family during that same period of time. That same study showed that Muslims in particular, among other religious groups, have increased odds of seeking treatment for a suicide attempt. This may be related to how the subject is handled. While yes, the Quran says, "Let not your own hands contribute to your destruction," the verse finishes off with, "And do good. Indeed, Allah loves the doers of good." This implies that doing good may actually help to relieve some of the feelings that can lead to depression, self-harm, or suicide. Studies have shown that volunteering with the intention of helping others helps people feel more socially connected and actually helps alleviate feelings of loneliness and depression. Aristotle, the Greek philosopher, deduced that life is about serving others and doing good, which begs the question, was Aristotle Muslim? Well, not likely, since he lived 300 years before Christ, which is way before Islam. But going back to the faith of the Muslims, the Quran also says, "And do not kill yourselves." But the verse finishes off the thought with, "Indeed, Allah is to you ever merciful," which gives hope to the person suffering that God has mercy and compassion towards them. The Quran gives us examples of how we should treat the subject of and those suffering from depression, self-harm and suicidal thoughts. When approaching this sensitive subject, be as gentle, be as merciful, be as compassionate as God when he discusses the matter at hand. By opening a dialogue with our teenagers this way, we are vehicles of help rather than hindrance, God willing. We hope you enjoyed this episode, so let us know what you think in the comments section. Meanwhile, share this with your friends and stay tuned for the next one.